thank you to Charlotte, Jade, John and the Institute for allowing us to host this event in regards to raising the awareness about Polycystic Ovary Syndrome. So for those that don't know myself, I am Chand Kaur and I am the founder and chief exec of PCOS Relief, a charity I established after my own personal journey being diagnosed with the condition. And through the journey of being diagnosed, I established that I wanted to actually create a charity that would bring meaning and would bring actually a purpose for females diagnosed with this condition. So we focus on the advancement of health education, and we also focus largely on females within an ethnic minority background, because we know this condition that's linked with infertility and other health conditions can be a stigma and a taboo for females within ethnic minority communities. So we're very health focused. We're very much focused in terms of making a change, raising the profile, but also providing services dedicated to females. Not looking at females just because they're diagnosed with PCOS. That means that everybody's going through the journey. We look at them individual and we tailor their journey specifically for them. So we've got services such as weight management classes, diet and nutrition classes, comfort talks to support mental health and well-being. And then we've also got the monthly steering group that allows our members to come online once a month and have a platform to network with their peers, but also have an opportunity to speak to a healthcare professional on a certain topic that we might be hosting about. We've done a lot of events, and I think one of the most successful events was our event in the Scottish Parliament. It allowed for self-lived experience females to come together in Parliament and raise the need for more awareness and more support around this condition. So that's myself. I will pass it over to Eugenia Grant, who will do an introduction of herself, but she is a fantastic ambassador for PCOS Relief, so it gives me great honour to be passing it over to her to speak. Thank you.
Thank you, Chand. That's really lovely of you. I'm just going to share my presentation, and there I will probably introduce myself. I hope everyone can see it. And I'm just going to just go full screen. So I will be talking about, I sort of go through the overview of Polycystic Ovarian Syndrome and discuss the management of the condition. And I'll just tell you a little bit about myself, who I am and what I do. So my name is Eugenia, as Chand said, and I work as a dietitian and nutritionist, and I have a special interest in PCOS, reproductive and maternal health. I graduated as a dietitian in 2012, and then I started working as a dietitian 2 years later. And I worked in different specialities, mainly in hospital and acute setting. And then gradually I moved into community setting, and I really got interested in fertility and female health. It was partly due to the fact that I'm a female myself, but also I could see a big gap in sort of availability of support for women, and especially for females with PCOS. And it really got me interested, and I started focusing on supporting women who had fertility problems, and many of them had Polycystic Ovarian Syndrome as well. So this is how it all started. I've got a little table of contents there. I want to talk about the diagnosis and the prevalence of the condition. We'll discuss the management and the treatment, medical treatment, and my main focus would be on the dietary treatment of PCOS. And then I want to discuss the importance of having the individualized advice as well, rather than one approach that fits all. And then we touch gently on vitamin and mineral supplements as well, or depending on how much time we've got, we may actually leave the last topic. PCOS or Polycystic Ovarian Syndrome, or sometimes I also hear it's called PCOS, so it really depends on how you want to pronounce it. It's the most common endocrine disorder amongst the women of reproductive age, and there are a number of characteristics that women have in order to be diagnosed with the condition. First of all, we often see an androgen excess. We see that there is a problem with ovulation or ovulatory dysfunction, and also the ovaries may look polycystic. We know that about 6 to 10% worldwide, 6 to 10% of ladies worldwide have the condition. We know that some ethnic minorities actually have higher prevalence rates, and we also know that many women are undiagnosed, so probably this percentage is a lot higher than 6 to 10%. We don't know how much higher, but I think the research is going on. There is quite a lot of confusion when it comes to the diagnosing the condition, because the symptoms are so variable, and not everyone is reporting the symptoms. But yes, there are a whole bunch of symptoms that ladies experience, and this is why the condition is called a syndrome, because you may have a different presentation of the condition. But main symptoms are irregular periods, excessive hair growth or hirsutism. Some ladies report thinning of the hair, acne, and then insulin resistance. Fatigue is a very common symptom that I always hear about. Depression and mental health problems, so in general, are more common in ladies with PCOS. And the symptoms that are similar to IBS, so when you have sort of an upset tummy, diarrhea, constipation, a lot of gas, that is common in ladies with PCOS, and also sleep issues. And I think when I meet my patients and we discuss their symptoms, quite often females would report at least 3 or even more symptoms out of the list, which you can probably imagine can have quite an impact on quality of life. Right. Yep, it wasn't moving. My slides. The diagnosis. This is where it starts, and there are the Rotterdam criteria that the doctors follow, and a female must have 2, or must meet the 2 of the criteria out of 3. And we need to exclude the other causes for the symptoms. So the first one is so we have the irregular periods. And I'm not a gynecologist, but as I told you, I work as a dietitian, but I often discuss periods with my patients because they really would like to discuss that. And I think one of the goals that I have in my clinic is to make sure we improve the cyclicity of periods. This is why I do discuss periods sometimes. So the cycles can be less than 21 days, or they can be longer than 35. And this is how we would define irregular periods. The second one, the second criteria is the hyperandrogenism, is when you have an excess male sex hormones or excess androgens. And we can have clinical symptoms of that. So the clinical symptom would be having acne on your skin. You would have excessive hair growth or hirsutism, again on your face, on your tummy. And then you may have a male pattern thinning of the hair or hair loss. So you would be losing hair somewhere on your head, unfortunately, on your scalp. So these are the clinical symptoms of high testosterone, but you may actually also have a biochemical symptom. You might check the bloods and see that you will have a high testosterone on the bloods. So some doctors would test your biochemistry, and other doctors would go by the clinical symptoms. Ideally, we probably need to go both ways. And then the third criteria is when the ovaries look multifollicular, or we call it a PCO morphology, so polycystic ovary. Now, these are not actual cysts. but multiple follicles that look like cysts, and this is how the name came along, as far as I understand. So you need to have 2 of those criteria in order to be diagnosed with the polycystic ovarian syndrome. So 2 out of 3. When it comes to ladies or females who are younger, the adolescent ladies, so the diagnosis is slightly different because they wouldn't get an ultrasound. Normally we would go by the clinical symptoms of irregular periods, and then they might get a blood test, but they wouldn't get an ultrasound because the ultrasound is needed or can be used about 8 years after your first period started. There's more information on a nice website as well. If you're interested, we can send you a link. I've just added it at the bottom. And if you will have questions about diagnosis, please let me know. I hope I'll be able to answer, but then if not, we'll ask our other ambassadors, doctors, to clarify. Now, it's not moving again. So, and I think the Rotterdam criteria has been very popular and used worldwide, but recently a new guideline came out. It was done in 2023. It's relatively new guideline, and it's very detailed, and it has all sorts of scenarios. And I do recommend looking at it as well if you have an interest in PCOS, because it has a lot more detail than actually a nice guideline. And I have a link there as well. Now, sorry, apologies. And you may ask, okay, so why do we need to get the diagnosis? Maybe we should just manage the symptoms. But we know that ladies with the PCOS, PCOS are at high risk of diabetes, high blood pressure, and coronary heart disease, and fertility issues. And if we don't have the diagnosis, then it's hard to work on prevention of these problems. So we need to have a diagnosis because it can help to reduce the risk of metabolic disease in the future. And it can help women to get the support they need. And it can improve the symptoms and quality of life, because a lot of women do report struggling most of their lives with fatigue, cravings, fertility issues, not having periods and losing hair, and then nobody wants to talk about it, unfortunately. So, but when you have the diagnosis, at least you can research it and you can find the professionals that can help you. And then a very important aspect is, of course, fertility and family planning, because if you don't know that you have a medical condition that can affect your fertility, you can actually postpone family planning to when you're like 35, 40. And then for many women, it probably would make sense to start planning a little bit earlier, because we know that polycystic ovarian can unfortunately make it longer for you to conceive. If you start earlier, you'll get there quicker. Yeah, so it's important for family planning and fertility. Also, it can help to improve that tendency to maintain healthy lifestyle and engage in physical activity. Because if you know that you have a condition that is managed by healthy lifestyle, then you're more likely to do it, rather than if you're just being told, oh, just lose the weight and you'll be fine. But you know that, oh, if you have a medical condition like PCOS, nobody wants to get diabetes, and you would be thinking, oh, I'll just maybe do a little bit more walking, I'll eat better because I want to prevent those problems. So we know that when ladies have the diagnosis, they're more likely to engage in healthier lifestyles. And the last one is about the endometrial hyperplasia and endometrial cancer. Again, that can help when we know why the periods don't happen regularly. We can at least get the treatment for that and induce a period, and that can help to prevent endometrial hyperplasia. And yeah, I think that's quite an important aspect for females with PCOS. I have met some ladies who haven't had a period for 15 years and for 10 years, and I think that is a very long time, and it can become quite serious if you leave it like this. So it's good to get the diagnosis and see the professionals and get support, right? So now the medical treatment of PCOS, I have treatments that are aimed at different symptoms. So the first one is the weight loss and lifestyle change. Now, I would say it's number one because it's the most efficient treatment of the condition. And I have mentioned in the brackets that we can consider medication for weight loss. And it's good to have that in mind for the cases when you've tried everything and your female patient is doing everything they can, but the weight is not moving or actually is increasing. So this is when we consider medication. And I as I work with ladies who have PCOS on a daily basis, I do have maybe 5 females that are following all the recommendations, but unfortunately not achieving their targets, their own personal targets. And I think one lady in particular is actually gaining weight despite everything she's doing. So I think in cases like this, we have to consider medication. We do use orlistat medication, which is a tablet that stops you from absorbing fat from your food. And we also hopefully will start using the weight loss injection called Wegovy, and then there's another one called Manjaro. So far, my patients have been using it, and they've been self-funding the treatment. But when it comes to the NHS in Scotland, we are not providing the injection as yet, but we are very hopeful that we'll get it soon. So yes, so the first one is weight loss and lifestyle change. The second one is the treatment that will help to improve the menstrual cyclicity. And there are various treatments available that is normally prescribed by a doctor. So you get a combined oral pill. You can get progesterone-only pill, and then some ladies get like Mirena coil or similar, the intrauterine contraceptive devices. And the last one, the intrauterine contraceptive device, is not only used for contraception in ladies with PCOS, it used also for period in terms of when the period is very heavy and painful. Sometimes that would be used to treat that. Yes, and then there might be other contraceptive pills available on the market, but normally the doctor would decide which one is best to use, and they sometimes use one, then another, and then they might use something else. The next treatment that can help to improve menstrual cyclicity is metformin. Metformin is the medication that is not licensed for PCOS treatment, so it's normally is used off license, and it can help to reduce insulin resistance, and it helps to reduce testosterone levels as well. And this is how the periods improve, the cyclicity improves. And I often see that after using metformin for a few months, you do get a more regular period, provided you also made dietary changes as well. Now, then doctors also treat fertility issues, and they normally use either Clomiphene or letrozole, or they do have other medications as well. So those medications can help you to induce ovulation. And if a female had a problem with having an ovulation, and this medication can induce one, and then pregnancy can be achieved this way. And in the center where I work, this is widely used for the treatment of fertility issues. And the last medical treatment that is being used is to tackle hirsutism, or excessive hair growth. And one of the popular medications that is being used is called spironolactone, and it helps to reduce the hair growth. From what I'm hearing in my patient group, it takes quite a few months to actually start working. And many females actually use laser therapy, or sometimes just like shaving as well, to reduce the hair growth when it comes to face. Yes, so these are the medical treatments, and they tackle different aspects of this condition. But the first one that is recommended is the lifestyle change. And this is where I come in and help patients. Now, I wanted to tell you a little bit about the dietary management of polycystic ovarian syndrome, because it is different from managing obesity in general population, which is, I think, a confusion that people have sometimes, that we have to target specific aspect of PCOS to get to our goals and achieve weight loss. It's not about eating less and moving more in PCOS management. So our primary goal is to improve insulin sensitivity. And I think when I discuss it with my patients, it makes a big change, because most of them have been told to lose weight all their lives. And sometimes they don't want to see me. They don't even want to see me when the doctor says, oh, go and see that dietitian. We have Eugenia. You need to see her. And they come in and they would tell me, look, I didn't really want to see you because you're a dietitian and you're going to tell me to lose weight. And I only came because I need a fertility treatment. And I thought, if I'm not going to see you, they're not going to give me the treatment. So I usually start from sort of discussing PCOS and our goals, but from a different angle. So yes, the insulin sensitivity is one of the goals that we hope to improve with the diet, with the correct diet. Then we look at the reduction in cravings and hunger, because again, cravings are quite common in PCOS because of high insulin levels in the blood. And hunger is another one. I often see females that eat once a day or snack through the day because they believe that this will help them to lose weight. And we work on reduction in hunger and regular eating as the first step. Then we do work on the prevention of nutritional deficiencies, because we know that ladies with PCOS are at higher levels, at higher risk, of developing vitamin D deficiency, zinc deficiency, magnesium deficiency. I've added B12 and iron there as well, because many females are at risk of developing iron deficiency when they have very heavy periods. And then if you're vegan or vegetarian, you may be at risk of developing B12 deficiency as well. So we discussed that with the ladies with PCOS, and we also want to make sure the diet is enjoyable and pleasant. And then when we've done everything, we are hopeful that we will achieve the realistic weight loss of 5 to 10%. And the discussion around the weight loss targets can be quite sensitive, because many ladies feel that they need to achieve a large weight loss because they want to look a certain way. Then we also have the doctors who want them to achieve a specific weight loss for fertility treatment. So we have to discuss the realistic goals. So this is what I'm focusing on when I'm managing my patients with PCOS. All right. I'm going just to give you a little overview of PCOS-friendly diet, but I'm not going to go into detail because I think too much information can be overwhelming. So we often break it down in shorter sessions with the patients. So now what we normally do, we discuss glycemic index, and on the graph that you have on the right hand side, you have different foods that have a high glycemic index and a low glycemic index. So it is attributed to carbohydrates. So carbohydrates that have low glycemic index, they normally, the sugar from them is absorbed slowly, and you can see a very nice yellow curve there. And then you have foods that have high glycemic index, and the sugar from them will be absorbed quite quickly, and then it will drop. Now, an example of low GI food would be, for example, brown rice or wholemeal bread. And then an example of high glycemic index food would be white bread or white overcooked pasta, for example. So we normally recommend that ladies would have a moderate intake of foods that release sugar slowly. We recommend that ladies would eat smaller and more frequent meals. Then we would make sure that they have some healthy fat, like omega-3 from seeds or oily fish. We also recommend a good amount of vegetables, and when fruits are eaten, they need to release sugar slowly, so they need to be low GI. We discuss lean proteins and making sure that whatever carbohydrate is eaten, it needs to be paired with the protein. We also chat about dairy, and that we normally would reduce dairy to 2 portions a day, just because some ladies have more acne on their skin and dairy makes it worse. But if you're unable to eat any dairy, we would suggest that you have a substitute that is fortified with calcium and vitamin D. We talk about milk, full cream versus skimmed milk, and I think I'm probably not going to discuss that in more detail because it's there are some studies that say that if you have a higher or full fat milk, for example, you may have higher levels or rates of ovulation, and ladies who have skimmed milk, their rate of ovulation a bit lower. So normally we discuss that with our patients. We discuss gluten as well, because gluten is being discussed online quite a lot, and many women have been told to stop eating gluten and dairy completely. But there is evidence that gluten can make your tummy worse, but you need to have celiac disease, so you could completely stop eating it. And I actually see a lot of women that stop eating gluten without being tested for celiac disease. And normally we need to have a test first to rule it out, and then consider maybe a modification or stopping it. So, but I think this is, again, quite a controversial area that ladies need to have education about. And then we discuss probiotic foods. So this is what we normally focus on with our patients. And when you go online and look for advice around PCOS, you often see that you have to stop gluten, you have to stop fruit, you have to stop dairy, you have to stop carbohydrates and soy and everything. But actually, you don't need to stop that. You can reduce gluten if you have tummy problems. You can reduce fruit if you're having too much, or you can just swap the types of fruit that you're having. With dairy as well, if you don't have acne and you tolerate dairy okay, you don't need to stop it. Soy foods, there is a lot of misinformation about soy foods, but generally whole soy foods are safe to eat. And carbohydrates, we need carbs to keep going, so we can't completely stop them. Now, I also educate my patients on key food groups like whole grains, lean proteins, vegetables, low GI fruit, fish and seafood, healthy fat, dairy and alternatives, and educating females about why they need to eat those groups can be very helpful, because then they want to prevent nutritional deficiencies. They want to become more sensitive to insulin, and it gives them a lot of empowerment that they can do things to manage PCOS, and they often report that they actually feel better, and the fatigue reduces because now they're eating more regularly after a couple of sessions with myself. I have a slide about probiotics, but probably I'm not going to go into much of a detail about it, but we know that probiotics are those friendly bacteria that we have in our gut, and they can help our immune system and enhance our health. And probiotics have many functions, and one of the main functions is that they produce molecules that help our immune system, and that they protect our bowel because they form a protective film, and they protect us against viruses and harmful bacteria as well. There's a lot of data that's coming out about probiotics, and that ladies who have PCOS don't have enough of the good bacteria in their guts. And this is actually quite, it makes a lot of sense, because I would say most of my patients report that they have problems with their tummy. And this is why women want to reduce gluten or cut out dairy, because they always thought they had an intolerance, but maybe they haven't those issues because they don't have enough of the good bacteria. And if we were to replace that, the tummy problems normally actually improve. I do have quite a number of cases that, we've reintroduced probiotics, the friendly bacteria, and symptoms just resolved. And there is a lot of research going on about probiotics, and there's some emergent data that is showing that when you eat more probiotic foods, it can improve not just your tummy, but also other aspects of PCOS, such as cholesterol, insulin, testosterone, inflammation, and fertility. So, right, I'm just going to move. And I just wanted to tell you about which foods contain probiotic, because when I mention probiotic, people straight away start thinking that they need to buy tablets or liquids or something. And we know that they're everything is so expensive nowadays. So you can get your probiotic from food as well, yogurt, milk as well, fermented and unfermented milks, miso paste and kimchi, sauerkraut, tempeh, and we have some juices that have probiotics added, soy products have probiotics added, and then granola bars and cereals. When it comes to granola and cereals and cereal bars, we just need to check the contents for sugar, because some of them are quite high. So the easiest way of getting your probiotic is to have your yogurt once a day, but yogurt needs to have live bacteria in it. Or if you are really unable to tolerate any of those foods, then you could probably consider a probiotic, but normally we only take probiotic for about 3 months. We take it in a course of 3 months, then we stop and see how we are, and maybe we need to repeat it once or twice a year. Right? Yeah, so I think this is the last part of my presentation, but I really wanted to discuss that it's extremely important to make sure that we have an individualized approach to each patient, each female who has the condition, because people have different goals in life, they have different work environment, they have different families and family settings. So the approach needs to be tailored to that particular person. So normally we do that by looking at the blood results, whether they already have maybe deficiencies and nutrients, maybe they have high blood sugars, maybe they have high cholesterol, or maybe they have deranged liver function tests, and we need to focus on that. We'll look at symptoms and priorities. We'll look if someone has a lot of problems with their stomachs and guts and a lot of GI issues, we need to focus on that. But if someone doesn't have any of those issues, but they have a lot of cravings for sugar, for carbohydrates, these are different symptoms, and we're going to focus on them. Also, we would take a very detailed diet history and discuss dietary habits, and we'll look at previous experiences that they had, and, for example, a history of disordered eating or a history of eating disorder, which needs to be taken into account before we start providing advice. We'll look at medical history. Maybe a female who's coming to see me has a number of other medical conditions and PCOS. We'll look at the goals, fertility treatment or fertility, weight loss, regularity of periods. Maybe that particular female is perimenopausal and she is going to develop menopause soon, and we need to focus on that as well. We look at stress levels, at culture as well, the cultural background and ethnic background, and we look at the personal preferences as well when it comes to the diet. Yes, so again, there's no one approach that will fit all women when it comes to evidence base. When you look, again, if you search for advice about PCOS online, some professionals would suggest that you only follow this diet, gluten-free, milk-free, no carbohydrate, no caffeine, and this is it. There is no other alternatives. But actually, when it comes to how I manage my patients, I always make sure I look at everything and make a plan that is individual to that particular patient, and that is evidence-based as well. So we're nearly there. Just in the summary, I wanted to say that it's really important to make sure that we get the diagnosis right, and that we also record the diagnosis in medical notes. Because if something is not recorded, it's not there. And having the diagnosis, like a proper diagnosis, is important because it can help to improve quality of life. It can help to get the support you need at work, at the GP surgery, and also it can help you to prevent problems in the future. So we need to make sure that if someone has clinical symptoms with hirsutism, losing hair, weight problems, ovulatory problems, period problems, that this has been investigated further. Now, the dietary advice and lifestyle advice ideally needs to be provided by a trained professional like a dietitian, because the advice would be more specific to the medical condition, PCOS. You are not going to be told just to eat less. You will receive advice that is tailored to PCOS. And we need to remember that food gives us energy and it can improve PCOS symptoms, and also that we can focus on foods that we can include in the diet, not exclude, because quite often ladies want to exclude foods rather than include. Right, like, Kate, I think this is all from me. Thank you very much. I've got my contacts there just in case if you need anything. Chand, this is me. I hope it's okay. I'm not finished too fast.
Yeah, no, all good, thank you. So before I open up to questions, I obviously just wanted to just talk about a little recommendations that we would advise or support organisations if anybody within their organisation is diagnosed with PCOS. So I think just all in general, be supportive. So it is a condition that unfortunately has no cause and no cure as well. So when I say no cure, I do like to say that link it up with there is management support there, but unfortunately it's nothing to say that, you know, within a certain period of time or after having this medication your symptoms are just magically disappeared. It's not a condition like that. So I think it's really important to raise the awareness, be present when somebody's talking about their condition of PCOS, because again, it's linked with so many other health conditions, and mentally it's so hard just to manage this condition. I think it's so important that we create a safe space within working environments for females, because it is a massive toll and it's so hard to deal with your personal health as well as working in a busy environment. So I think it's always beneficial to have a safe space for females within work environments. We do like to advise organisations to have flexible working, and I know a lot of corporate companies and other industries does offer offer flexible working, but when we talk about flexible working, this condition is sometimes you do need to go and see your GP quite often. You do need to go and see a healthcare professional, whether it's a gynecologist or a dietitian, and sometimes you do need to take an appointment within working hours. So a lot of females hesitate to take it because they fear that they need to make up the hours on a different day. So what we like to offer at corporate or offer advice in terms of allow females to have that flexible working where they don't need to pick up the hours on a next day, because that means that they don't feel guilty in leaving, but they get the support that they require in going to see their GP or the hospital appointment or whatever. We do like to say implement a health and wellbeing program within your organisation. I think this is something very encouraging to support healthy lifestyle options. It's something as an organisation that you can support your members with. So if they wanted any information in terms of healthy lifestyles or wellbeing, at least you've got something within your organisation that can promote that. There's always one thing that I used to come from a law background, so one, it was a busy environment, but two, when we had our clients' engagements, there was always going to be sandwiches and brownies and food that would just be so yummy to eat, but very bad for me personally. So I would always encourage organisations to have healthy food options. Now, I had a really interesting conversation over the weekend. They said, yeah, but we ask for dietary requirements. And how often do we know that eating healthy or fibre food is a dietary requirement? Because for me, I think a dietary requirement, if that's like a vegetarian, or if I'm going to eat, like, for example, halal meat or something like that, that's not really dietary requirement. So having the options of healthy food, fibre foods available can really make a difference for a female. And she can be comfortable in eating. Because sometimes with this condition, you can develop an eating disorder. So it is so important to have those options available for females. I don't know if you all know in this call that PCOS Awareness Month is September. So just raising as much awareness as we possibly can in the month of September, as well as every month. But if not, then making sure that we do a lot of awareness and showing our support in the month of September. And the last thing that I just want to do, obviously, as a recommendation is when we are, for example, the recruitment process. So when recruiting, I think we now live in a world where a female is going through a women's health condition, whether that is PCOS, whether that's endometriosis, perimenopause, menopause, whatever that condition is. So I think what we're doing is we're supporting a lot of organisations with their recruitment process, how to ask people, are you suffering from or are you diagnosed with a condition? This allows employers to best understand their employee and best provide the support for them, allowing them to be comfortable at work. So we're currently supporting organisations in how to ask the questions, how to best recruit females and how to support them, as well as we do have a PCOS Relief work policy, and that supports the employers as well as the individuals within their work environment. So that's just a few recommendations. Obviously, I'm more than happy to send them over to Charlotte for the Institute, and she could pass that out to everybody, but I'll just open it up. I think we've got about 15 minutes left, so open up for any questions anybody may have. Thank you.